Hi, I'm Dr. Lisa Hernandez, and we've been speaking about back to school. It's the end of the summer, and we just finished speaking with a guest that gave us great tips about getting good meals for our children, both for breakfast, lunch, dinner, and even snacks. We're going to change gears now and talk about vaccines and how vaccines help prepare our families as well as our children from certain diseases. Our next guest is Molly Hubbard. She is the immunization coordinator for the Monterey County Health Department. She's here to join in that conversation about back to school, and she'll be giving us important information about vaccines and why they are so important. Molly, thank you for coming.
Thanks for having me.
Again, another busy day, and we're revving up for flu season coming up, and we'll be talking a little bit later about pertussis. So I know your schedule is busy, so again, welcome. So talk to us about the question that I think a lot of us have on our minds. Why are vaccines so important?
Well, I stay busy because they are very important. Really what we've seen is that vaccines are one of the most important public health interventions that we have. They're safe, they're effective, they're cheap compared to going to the hospital and getting very sick. What we have is protection against these very serious diseases that can cause very serious ramifications for people, including death. So it's a very great thing that we have them around, and it's a great tool because it not only helps those that get the vaccine itself, but it helps those around them. So we can help keep the whole community safe and have what we call herd immunity by making sure that those that need vaccines get them on time when they're recommended.
So you mentioned that it helps protect us against certain diseases. Can you name some of the diseases that vaccines protect us from?
Yeah, there's a lot of different diseases that we get protection through vaccination from nowadays. There's up to actually 13 different diseases that we get protection from. Some are more of the little-known ones that maybe our parents or grandparents have heard of more than ourselves. Things like measles and mumps, luckily we don't see much anymore because of vaccination. And then we have more vaccines now that are helping to curb more diseases that are still fairly common. Things like chickenpox we've probably heard about or even experienced ourselves, and luckily we get to protect ourselves from that. And then things that unfortunately we're still pretty familiar with, like whooping cough or pertussis.
Great. And who should get vaccinated? Who should be immunized? It sounds like it can be anyone from a child to an adult. Is that the case?
Yes, I think when we think about vaccines, traditionally we think about babies getting vaccines. And really what we need to know is that vaccination is a lifetime experience nowadays. We have the young that need to get vaccinated, and we also need to make sure that adults get vaccinated. They could need it because of their age, so we try and make sure that some of our more wise adults, our older adults, make sure they're vaccinated with things like pneumococcal and flu. And then there's other adults that have certain risk factors, maybe because of their job, maybe they're a healthcare worker, so they're exposed to more things and maybe more at risk for getting them and also more at risk for spreading them to other people that might be medically fragile. And then also we have adults like our new parents, one of the groups I recently joined, and what we want to do is make sure that they're vaccinated so that they can help protect the youngest in our population, those cute little babies.
Well, I like that point that you've made a couple of times, and I want to make sure everyone remembers that, is that vaccines help protect yourself as well as the people around you. Sometimes it's because people can't get the vaccine because they're too young, or because of health conditions, or they haven't had the opportunity to get vaccinated, but you're protecting yourself as well as others when you do get vaccinated. So you mentioned there are about 13 diseases that vaccines prevent illness from. Why are there so many vaccines?
Well, because there's a lot of advances in technology today, so we get to keep our kids safe, and we get to keep our adults safe from more and more diseases out there. We've been able to have more vaccines come on the market, and that's a very good thing. These are all diseases that have serious complications. And so whether it's like that measles or that mumps that we might not think we're at risk for anymore, you know, there's things like traveling that might put us at risk for some of these diseases, or like we're experiencing right now, whooping cough exposure in our day-to-day life here in Monterey County. So it's really important and really valuable for all of us that we have these extra ones. Some people get a bit concerned that it might be too many, but really what we want to remember about modern vaccines is that they've really come a long way. We have different purification techniques in labs, and the way we make vaccines is very different. Instead of it being the whole virus or bacterium, it's just the little parts that you need to have immunity against that disease. So it's a much simpler and purified vaccine, and thus it's a lot easier for your immune system to experience than the vaccines that we all got lined up for. Well, I'm sorry, not myself, but that our grandparents got lined up for in schools, things like the oral polio vaccine. The polio vaccine that our children get is much more simpler, much safer.
So that's also a good point to bring up, is that you're not really getting the whole virus or the whole bacteria when you're getting either a shot or if it's flu, the spray in the nose. You're just getting the parts that allow your body to make a response to, that your immune system can build the cells that it needs to protect itself.
Well, and actually there are a few whole live vaccines out there, and you mentioned one of our few, the nasal vaccine that is a flu one, and that's recommended for kids. And actually it does benefit from that purification, and the good thing about that nasal one is it actually creates a slightly better response in children. So the ones that we do have out there, they're much different than the earlier generation vaccines, and what we have across the board is just better safety, more protection, and we have very robust systems for making sure that they continue to be safe and effective throughout the country.
Great. So let's move on to kids a little bit more. Why are kids required to have certain vaccines on board before they start school?
Well, back to school time is very important for vaccination. The thing that we see about kids in this time of year is that we know that they don't like to share, but they still manage to share those germs. So basically with back to school, you have new risk. Instead of being at home and being around their siblings most of the time, they're starting to be around more and more children. So that increases their likelihood to be exposed to things. And so we want to make sure that they get into those doctors. It's a great checkpoint. So they have new risk. We're going to do a checkpoint where we know they have to go to school, so let's make sure that they go into the doctor, they get checked out for vaccines, and they also can get a physical so that they know that everything else is progressing along well. All those developmental milestones that all of us parents try and check off, the doctor can make sure we're hitting all those boxes.
So school is an increased risk because kids are not outside playing and enjoying the summer weather. They're inside, enclosed, where they may be closer to children that they normally aren't interacting with, like their family or friends. So that's also a good point, is that you want to get kids protected before they are exposing themselves in new settings and potentially to new children.
All those doorknobs, all the handles, everything that they're touching that mom doesn't get to clean down.
And are there specific vaccines that are required for school entry for children?
Yes, there are particular ones that are laid out in the state law that are required for schools, things like hepatitis B, MMWR, the measles, mumps, rubella vaccine, DTaP for our younger ones.
Which is?
You're going to get me there. Diphtheria, tetanus, and acellular pertussis. It does have the pertussis protection right now that we're all very eager that everyone gets coverage at the moment. The thing that I like to point out about the school requirements is that the legislation for the school was put out quite some time ago, and it was based on the medical recommendations at the time. So based on where it was based on things that are getting to be almost a decade old now. So we have a lot more things to help, a lot more vaccines to help keep our children safe. So your doctor may tell you that your children need more vaccines than what the school is looking for, and that's great. Make sure you go with the doctor's recommendations because they're going to be the most current on every tool we have to make sure that our kids stay healthy in their classrooms.
So what happens if enough parents stop vaccinating their children? What do you see as a side effect of that sort of practice?
Well, I think it's very important to point out the herd immunity. I alluded to it earlier, and what we need to know is that it's not just an individual thing to get vaccinated. It affects yourself, but it also has a great bearing on your community. It helps to keep everyone safe. So with each disease, depending on how it's transmitted and how infectious it is, there's a different level of protection we need on a whole, for the whole community.
Or the herd.
For the herd,
right.
Yes. I like to think we're a little more important than the heifers out there. At least we probably, the two of us don't want to describe ourselves as such, but we do need the protection for everyone and at different levels. And when people start opting out, we stop getting that coverage that we need to get to. So a very good example is measles. There was a study that was put out in England which falsely linked the MMR vaccine with autism. Since then, that study has been discredited in a major medical journal. Every person that's been associated with it has backed away from the study, and the lead author actually had his license revoked. It was a very poor study, and what it did was, unfortunately, it made parents concerned, and some started opting out. And so the herd immunity dropped in London. What we saw in 2009 then was there was over 1,000 cases of measles in London, or in England. And unfortunately, that could mean very serious side effects. You see examples like this across the world of once that herd immunity starts dipping, then you start seeing disease. And unfortunately, these things won't be memories that our grandparents are telling us about. They'll be experiences with our own children. And it's a very, very sad thing to see something that can be prevented so easily and safely that doesn't happen.
Well, I think you pointed that out early on about how vaccines are one of the #1 ways to protect ourselves against infectious disease. So when we don't participate in that, then that's when we see the loss of protection for the community. I'll say community, not herd, but yes, that's what we mean. So I wanted to talk a little bit about pertussis and or whooping cough, as we call it commonly. And that is something that we're seeing record highs here in California and in Monterey County in particular. I won't ask you any medical questions on that, but what I really want to ask you about is the vaccine and who should be getting protected against pertussis.
Well, and pertussis is another example of that herd immunity. It's a vaccine that our babies get, DTaP, and what we've learned over the years is that it actually starts waning the protection from those shots that our babies have. And so that herd immunity went down, and what we realized is that adolescents and adults were getting whooping cough and spreading it around. So unfortunately, we've had 7 babies across California pass away from pertussis this year, something that is just heartbreaking to think about because we do have Tdap, which is a vaccine for those that are over 7 years of age that has protection against whooping cough or pertussis. So really what we should all think about as a community and as parents and as grandparents and those that want to just make sure that the community is safe is about getting vaccinated. So those people that are over 7 years of age need at least need a dose of Tdap vaccine. And they can find that many different places at their medical provider. They can go to places like VNA, they can go to Clinica de Saluds. We have 2 walk-in clinics, Al Sal Health Department and Seaside Family Health. And then also we'll be holding free Tdap clinics this Saturday. We'll be over at in the V&A parking lot with a mobile van from 11 to 2. And then we're going to be heading over to the health department parking lot in Salinas from 3 to 6. And you can get a free Tdap there if you've never gotten one yet. We want to make sure that everyone gets vaccinated and that we keep our community safe.
So there are lots of different places to get the vaccine. So your provider's office, at the visiting nurses' offices, and I know they have one office here and several offices, but the one closest to the station here is right on Lower Ragsdale, and that's one of the sites that will be holding one of the community vaccination clinics this weekend. So they're going to be there offering free vaccine 11 to 2?
11 to 2, 5 Lower Ragsdale in Monterey County. There's a lot of different providers' offices over there. Look for signs. We'll try and make sure it's pretty clear where we're at. There'll be a mobile van. We'd love to see you there. And then 1270 Natividad in Salinas, the health department parking lot will have the van again. Come check it out. It's a pretty neat little unit, and we'll get you a free vaccine.
And that afternoon clinic is from 2 to 5?
3 to 6.
3 to 6. I'm glad that you repeated it. So 3 to 6 in Salinas and 11 to 2 here in the peninsula.
That's correct.
And other places to get the vaccine, providers also at the health department clinic services, both in Seaside and in Alisal and Salinas. And those are walk-in hours from, is that 8 to 5?
8 to 5, they have slots that they have, a certain number of slots. You go in the morning and they'll assign you a slot. Okay.
And you mentioned something I want to make sure people know. If you are not sure whether you got, as an adult or as a adolescent, got a Tdap vaccine, is there a problem with getting another one? What should you do?
You should try and find your records first. Dig around in all those filing cabinets and see if you have a yellow card or something along those lines that documents a Tdap vaccine. But if you can't find that and you're not sure, it's okay to get revaccinated if that's the case, or hopefully get vaccinated for the first time. You just might end up with more of a sore arm, but you can walk around proud with that sore arm and know that you're keeping our youngest one, those little babies. Make sure that we don't add anyone else of our Monterey counties to those horrible stats. Be proud of your sore arm, come get vaccinated.
Right, and you mentioned that there have been 7 deaths in California, and they all have been infants under 1. So it's important that adults and young adults get vaccinated to protect themselves and the younger members of the community. Well, Molly, thank you so much for coming. I've learned a lot, as usual. I hope the guests have learned, and as well as the audience, about vaccines, why it's important to get them both in childhood and in adulthood. And we'll be having you come back again, because I always, again, enjoy having you and learn something. We're going to take a short break. This is Your Health Radio and Television program. Come right back. Thank you.